Thanks very much, and lovely to be here and see so many analysts. So I'll just very briefly explain what the ADI UK programme is. We're funded by the Economic and Social Research Council, and it's all about opening up access to government data to support research in the public good. And I say in the public good because the main legal framework that we use to support this activity is the Digital Economy Act, and it's embedded in the Digital Economy Act that all research done that uses this act as a legal framework has to be done in the public good. And we've been going since 2018. We ran as a pilot programme for the first 3 years, and then since 2021 we've been into our long-term investment period. And we are truly UK-wide, and yeah, there's a heck of a lot of research that's now being facilitated through our trusted research environments. We fund a small amount of the research that is done in the data by using the data that we make available for research use. And the largest of our trusted research environments is ONS, Secure Research Service, and that is free at the point of use. So everyone can analyse the data that's in there if you've got a proposal that passes a public good test. And yeah, this is a sort of schematic diagram of our partners, and you will see that, yeah, we are truly UK-wide. We have one trusted research environment in each of the 4 UK nations, and we also have direct partnerships with government and academic partners in each of the 4 UK nations. And that's really, really important, because whichever side you're coming from, each can add value to the work of the other, and it's all about building bridges effectively. We've also got the SafePod data access service that sits across all of our trusted research environments. So the vast majority of data owners are happy for this data, and it's portal access through all our trusted research environments. You never get downloads of data direct to your systems, and it's all the outputs are disclosure controlled and checked, so no individual level results ever leave the system. And for our most secure data sets, which tends to be things like crime and justice, police data, things like that, you have to access it through a safe room. And this SafePod network essentially creates that safe room network right across the UK. So whilst 10 years ago you'd have been hindered by location in terms of accessing one of these safe rooms because there were few and far between, that environment, that network is growing all the time. So that's no longer the barrier that it was. And as a programme, we're quite unique, I think, in that we fund the whole ecosystem of how this data is made available to researchers. So I've told you that we fund the trusted research environments. We also fund a programme of data linkage across each of the 4 UK nations. We commission a small amount of research that when we've got a new linked data set, we want to champion the use of that. We want to get it used. We want to be able to promote it. So we have a series of fellowships that we use to promote that. We also fund a cohort of PhD students who've currently got a cohort of 22 PhD students that we fund directly to use this data. There's many other PhD students who are using it who are funded by other organisations and programmes. We also have a really, really important programme of communications as well as public engagement. And that is really, really important because we have to be evidencing that this is doing what it's supposed to be doing, that research is feeding back into policy making within government. And the public engagement is obviously really important because we have to be maintaining that social contract to use this data for research purposes. And a lot of this data is very different from health data, where it's kind of very, very standard that you have to embed that public engagement because you're accessing identifiable information a lot of the time. It's not like that with administrative data. So the Digital Economy Act requires us to make the data anonymous, de-identified before it's made available for research use. So we're not doing it for a lawful reason. We're going above and beyond the law to maintain that relationship with the public, that we're doing the right thing with this data. And so when I talk about administrative data, it's essentially all of the data that is created as a byproduct of a system or service run by government. So it's everything from education records, everything from who's got special educational need, through to free school meals, through to educational attainment. It also includes health records and census responses. That's a really, really important linkage field for us, because it gives us important information such as self-declared ethnicity. And we've also got employment and earnings from DWP and HMRC, as well as court records from Ministry of Justice and police records. So the power of this data is not when you're analysing it individually as individual data sets, it's when you're linking across these data sets. And it's done in slightly different ways in each of the 4 UK nations, and there's really good reasons for that. And essentially we were set up, you might remember a programme, those people with long memories, there was a programme called ADRN, the Admin Data Research Network, that ran up until 2017. And unfortunately it was closed down early because the timing wasn't right to be trying to do this at scale right across the UK then. The Digital Economy Act hadn't been passed, so there wasn't a permissive legal gateway sitting across all administrative data owners. And if you think about devolution, which is a fantastic thing, but it means that every devolved topic, the data flows with the topic. So things like health and education, the data is literally split 4 ways. And there is a different education system in Scotland, to England, to Wales, to Northern Ireland. And so the data will be different. And that's essentially why, so even under the previous programme, we didn't manage to make a lot of progress within Wales, Northern Ireland and Scotland in opening up access to this kind of data. But in England, it was a fundamentally much more difficult problem because of the multitude of data owners and the risk aversion. And as I say, the model wasn't right. But we've really improved that, and we're now running at scale. And I mentioned that data linkage is really important for administrative data, because this is essentially a diagram showing if the data stay in the silos and it's never opened up for research use, then that's a huge missed opportunity for doing research in the public good. And it's a missed opportunity for improving the lives of people right across the UK. So all of you will know about all of these reports, I'm sure. It's just a collection of reports from over the last sort of 10 years or so that keep coming out with the same message, that effectively we need to be able to carry out research on the wider determinants of health. And I would argue it's the other way around as well. It's not just research on the wider determinants of health we need to be facilitating, it's the opposite way around as well. It's how does health impact on education? How does health impact on employment? Because we are all, people with more than one sort of aspect to our lives. And if we can't link that, if we can't understand what these interactions are, then it's very difficult to improve things systematically for all. So the old way of linking administrative data, which is very similar to the way still that NHS England use for facilitating access to a lot of data, is that you start with a project and then you do all of the incredible amount of legwork to create the data set. That's cleaning the data, it's linking the data, knowing that in our world there are no unique identifiers that we can use right across our data systems. And the project's completed, and then the data set is deleted. And you can see that when it's this kind of system, it's really, really difficult to justify the effort that you'd have to put in to create population-level linkages. So you're always trying to balance up the effort with the outcome, essentially, in that model. In our model, you start with the data set, and you get the data owners working with academics to create that data set and clean it and link it in a way that you understand the biases in the data, you understand what can be done to correct those, and you understand the richness of the data and the breadth of projects that it could be used for. And then you facilitate access to it through a trusted research environment, but for multiple projects. And the data set crucially stays for other people. So you're constantly building up that body of knowledge about how to use this data set and the outcomes that it can generate. And this is really, really important for in the social science world that I come from. The standard way of analysing data is to do a survey. And everybody understands that it's harder to reach some people through surveys than other people. So it tends to be the people with the most complex, chaotic lives that don't answer surveys. And you could argue those are the people most in need of government services. And I think this is the really kind of unique selling point of population-wide linked administrative data sets. So we're no longer hindered by trying to balance up the need of the project with the effort to create the data set, because we do that for you. And it's because in the health system, you're focused on trying to improve the lives of patients. In the prison system, they're thinking about people as prisoners. And DWP and HMRC will think about people as pensioners or working age people. And all of these things interact so that if you're stuck in one service because you're not getting access to healthcare, you've got mental health issues, you're not getting access to services, whatever it is, that means you can't go on to achieve your academic potential or your working life potential, then you get stuck in this system. And it's really, really difficult for those people stuck in the system where they're interacting with multiple services to improve that situation. They don't have agency over that system. That's why government needs to step up and start thinking about people with multiple needs, not just in these silos of interactions with one government department or another. And I think it's really important to recognise as analysts that just focusing on the average improvement of a service will never tell you how to fix these things for the people with the most complex needs, because they will always be at that tail end of that normal distribution. So if I just go on to some of the examples of what I'm talking about. Now, this is a really neat paper from Swansea University, published in Lancet Public Health, that links health data with police data. And it's thinking about women who are victims of domestic violence. Now, that is very much a kind of crime and justice outcome. However, these people often end up in A&E, and they've often got complex lives. And if you look through this decision, decision tree, you'll see that, and I know it's very small, happy to share the slides afterwards, but essentially you can find these people years before they present to the police with a what's it called, a police notification, PNN submission. And if you can find them because of their interactions with health services before they turn up in these police services, you are literally improving lives. And that's what I mean by you need to understand people's sort of complex lives. And this is all things like, do they smoke? Do they inject drugs? A whole load of risk factors there for understanding who is at risk of domestic violence. Another example one that's very, very dear to my heart because it's taken a heck of a lot of work to get this off the ground. It's taken over 4 years to, this isn't just the creation of the data set, this is over 4 years to work out how we can open up this data set for wider research use. So it's education outcomes, decades worth of education outcomes for England, linked to decades worth of health outcomes data. And there's a summary of that on the slide there. And this is really important because I come back to the fact that these are population level data sets. One of the first papers that was published from this by the team at UCL that we funded to work with NHS England and DFE to create the data set, did this paper on educational outcomes by gestational age. So you can track cohorts of children from the time, well, before they were born, all the way through to their education outcomes at 16 and beyond. And it turns out that if you look at this at a population level, then even being born just a few weeks early, there are small but significant differences between education outcomes later on in these people's lives. And that certainly as a mother, I was never told that. We didn't know that because this analysis has never been done before at that scale. And this, we've also funded this eChild data set to do further linkages so that you can now look at analysing data through mother and child relationships and also sibling relationships. And this is really important as well because I think we all know in this room that if you've got a severely disabled child, that has impacts for educational attainment on other children in that family. And we can now analyse this at a population level. And similarly, if you've got a parent with a severe mental health or physical impairment, that is likely to impact on the children. And we can now do that analysis. This is an example of a data set that was created by ONS during COVID. And it was done using the Statistics and Registration Service Act. So they can collect data for statistics purposes, but crucially, nobody else can use that data. So they linked 2011 census data with mortality records, HES data, and GP data. It's incredibly rich data, and the outcomes of it were used to inform a lot of government policies during COVID. And I repeat, no other analysts can get access to this data. It's sitting in the Secure Research Service in ONS. But because of the legal barriers to linking health with administrative data, at the moment, nobody else can get access to it. We are working with ONS and NHS England to try and improve that, but that is a huge missed use of data, I would argue. This is another really nice example of where we can use administrative data to look at health outcomes. Everyone will remember that a few years ago, Scotland brought in a policy around the minimum price of alcohol, and that was done because they got a huge issue with the prevalence of alcohol-related deaths in Scotland. And our partners in ADR Scotland did this really neat analysis looking at the kind of a natural control group of England that didn't have this policy, and Scotland looking at, well, what would have happened if Scotland had never introduced that policy? And sure enough, there is a significant reduction of alcohol-related deaths brought about by the introduction of that policy. We've got two other examples of linked data sets that are currently in development that we really, really want to be able to open up for wider research use. It's not clear exactly how we're going to do that yet, but we've got tenacity. We will continue. But these are really, really important ones. So the Kids Environmental Health cohort looks at environmental impacts on children's health. And, you know, thinking about pollution around schools, things like this, we can track that and we can learn from that. And the linked local data on children and young people, this is actually a data set from a part of London where they happen to have really good access to social care data for children, as well as all these other linked health data sets. And we're working with this team in North West London to open that up for wider research as well, because we want to be able to sort of make that case that this kind of data is there and what it can be used for, so that hopefully we can build that into a national data set over time. So what's been difficult? Government departments and NHS England are understandably risk averse. I completely understand that. But our evidence is that when you have the model right of putting data in trusted research environments and it's portal access only, then people are happy to get on board. Legislative differences mean it's more tricky to open up access to health data linked to administrative data. There's a clause in the Digital Economy Act, and I understand why it was there. It was all to do with the backlash of care.data back in 2010, and the Digital Economy Act was passed in 2017. There's a clause in it that says health bodies that have responsibility for health services cannot use this act to open up access to data. It doesn't say anything about other organisations not using this act to open up access to health data. So the solution we've got for eChild at the moment is NHS England give UCL a sub-licence agreement, and it's UCL acting as a data controller, not the data owner, who uses the Digital Economy Act to open up that for research use. You think of the public good that could be done, and all of that red tape that would go away if that clause in the Digital Economy Act was removed. And we've got all of these linked data sets ready and waiting if this legislation does get updated, maybe. And that's everything. I know we're running tight on time, so we'll stop there. And I think the questions are going to come after the next speaker, but very happy to answer any questions over lunch if we don't get time as well. Thank you.